I'm sure you all love visiting your doctors, especially that you have to wait for a week or a month to get an appointment, then take a day off from your work, and get stuck in traffic, and still you have to wait for hours and hours at their clinics. Well, in order to do or to avoid this, we tend to pick up the phone, call the doctor, send him SMS or WhatsApp, and we really get frustrated if they don't answer us or if they don't answer on time. Well, you're not the only one frustrated. Your doctor is giving you years of experience and knowledge, and in order for him to get compensated for the time and effort that he's giving you, his only way is to ask you to visit his clinic, even if your case doesn't require actual physical examination. And guess what? 75% of doctors' visits can be handled safely and efficiently by phone or video, as per the statistics done by the American Medical Association back in 2014. This is where we decided to disrupt the system, and we created Drapp, a platform that is based on chatbot technology that connects patients with their own doctors and doctors with their own patients using everyday messaging applications such as WhatsApp and Facebook Messenger and Drapp application. The interface is a simple interface like WhatsApp. So actually, the patient will be using traditional conversation, and by the end of the case, the doctor will be able to charge the patient. There are so many platforms out there, local, regional, and international. The main common trait between all of them is that they connect you with anonymous doctors, doctors that you don't know just because they are available. And there's an interesting study by Deloitte saying that 88% of patients do prefer to connect with their doctors of choice rather than with randomly assigned doctors. This is where our major edge. We connect patients with their own doctors without the need to actually download a new application on your mobile phone. We operate in a $34 billion market of telemedicine globally. 50% of US hospitals have already started telemedicine programs. The Middle East, and actually 5 countries in the Middle East, the estimates for online consultation is around $250 million, and we believe the early adopters would be travelers and expats. Our strategy is to reach to hospitals and sign contracts with hospitals in order to have access to their pool of doctors, and to sign contracts with doctors in order to have access to their pool of patients. And definitely, we're going to raise awareness for the platform through digital marketing strategies. Our pricing is per consultation, and as you can see from the doctor interface, by the end of the case, the doctor will charge the patient based on the complexity and time that he spent on the case, and based on preset pricing bracket that the doctor himself have chosen during the registration phase. Personally, I have long experience with healthcare. I deal on day-to-day basis with doctors, patients, hospitals, and regulators. And our technical design and marketing team is already complete and on board. We have a steering committee of 9 medical advisors from hospital CEOs and senior doctors and directors in hospitals and major hospitals. Our demo is already available for any of you who would like to test it at the booth. And we have already 15 doctors testing the platform currently. We have been recognized and endorsed by the Ministry of Health, the Lebanese Ministry of Health, back in July. And we're looking to reach 25,000 consultations in year 1. And in order to do so, we need to sign a contract with a hospital, as well as $250,000 to fuel our product development, as well as our marketing strategies. Drapp, your chosen doctors, a chat away. Thank you.